Madam President.
The senator from Minnesota.
Madam President, I ask to speak as if in morning business.
Without objection.
Madam President, over the last few weeks, hundreds of thousands of Minnesotans have received letters or postcards in the mail from their health care insurers. These notices are letting people know whether or not their insurer met a new rule in the health care law, a rule that I championed, called the medical loss ratio, sometimes called the 80-20 rule. It could also be called the 85-15 rule, but it's known as the 80-20 rule, and I'll explain. This provision, which I based on a Minnesota state law, requires large group insurers to spend 85% of the premiums that they receive from their beneficiaries on actual health care services. They have to spend 85% of the premiums they receive on actual health care services, not on marketing or administrative costs or CEO salaries. These dollars, 85% of their premium dollars, have to be spent on actual health care. And for insurers in the small group and individual markets, this threshold is 80%, hence the 80-20 rule. So this summer across the country, Americans are getting notices from their insurers that the insurer met or did not meet this 80 or 85% threshold. And when those notices say that the insurer failed to meet the medical loss ratio, Americans are also getting something else in the mail, a check or lower premiums for next year, because under my medical loss ratio provision, insurers who do not spend at least the 80 or the 85% of premiums on actual health care services for their beneficiaries have to rebate that money to their consumers. August 1st was the deadline for insurers who didn't meet the MLR threshold to rebate the difference to their consumers. And because of the medical loss ratio, more than 123,000 Minnesotans got rebates from their insurer. Those rebates added up to an average of $160 per household. It was more in other states. This isn't unique to Minnesota. Across the country, it was 12.8 million Americans got rebates from their insurers who overcharged them. And other insurers lowered their premiums for last year to comply with the medical loss ratio. Aetna in Connecticut lowered premiums by 10% last year because of the MLR. Minnesota has a culture of high-quality, low-cost care. In fact, the Agency for Healthcare Research and Quality recently announced that in 2011, Minnesota's health care quality was the highest in the nation. We were number one, again. We're always number one or number two or number three. And the medical loss ratio, which was first passed as a Minnesota state law, is yet another example of Minnesota's leadership in bringing down health care costs while preserving quality. Minnesota's unique healthcare culture includes the Mayo Clinic, cooperative models like Health Partners, and visionary public health leadership from state legislators. Healthcare in our state is also distinguished by the fact that 90% of Minnesotans are served by a nonprofit health plan. These plans outperform their national peers and are able to put 91% of every premium dollar toward actual health services. In other words, they have a 91 MLR. By taking profits out of the health insurance industry, Minnesota health plans do a better job helping our residents live longer, healthier lives and deliver the #1 quality care in the nation. And the medical loss ratio within the health reform law is holding all health plans to the same standards we've set in Minnesota by requiring that 80 to 85% of premium dollars actually pay for health services. Before this year, and other plans throughout the nation, less than 60% of your premiums were put toward health care. The rest was being used for administrative costs, for marketing, for bonuses, and for profits. In fact, one study of insurers in Texas a few years ago showed MLRs, medical loss ratios, as low as 22%, meaning that of all the premiums that families were paying into their insurers, the insurers were spending only 22% on actual health care services for them. And that's why my medical loss ratio provision is so important. It squeezes the fat out of the health insurance market and makes your premium dollars go further. For many families, it's actually lowering costs, delivering $1.1 billion this year in rebates. Those checks, $1.1 billion. And in addition, lowering premiums. For example, the 10% reduction by Aetna in Connecticut. This was an incredibly important step because we know premiums were going up way too fast, a lot faster than those families' income. This is just one way that the health care law is already changing the culture of care in our country. One of the other things that the law did was move toward rewarding quality of care, not quantity of care. Specifically, it directed Medicare to start paying doctors based on the value of the care they provide, not the volume. This is a provision that I and Senator Klobuchar and several other of our colleagues championed, called the Value Index. Because when Minnesota doctors get paid less for providing higher quality care, everyone loses. Minnesota loses because Minnesota reimburses 50% less per Medicare patient on average in Minnesota than for each patient on average in Texas. So Minnesota actually gets punished. It gets punished for being #1. It gets punished for higher quality care with lower reimbursements. Patients in Texas lose because they're not getting the highest value care for their health care dollar, and all taxpayers lose when Medicare pays for unnecessary or overpriced services in Texas and in other low-value states. This is not about pitting Minnesota against Texas or other low-value states. It's about incentivizing the Texases to be more like Minnesota, which again has the highest healthcare quality in the nation. And that will happen when the begin to happen when the value index kicks in under this law. It would be an understatement to say that the law has received some attention this year. And I know that there's a lot of uncertainty among our constituents about how the law will affect them. That's because sometimes there's a little misinformation put out there. I just had a colleague say that there's nothing in the bill to address paperwork, and that is certainly not true. In fact, I authored a provision on simplifying billing. There was some misinformation on why the IRS agents are there to look into your insurance rather than emphasis on anything done in the bill, in the law, to address workforce shortages. Well, that's not true. There's an entire title on workforce. You know, sometimes people have to really sort out what's being said on this floor. So there's some uncertainty. So let me just take a moment to talk about just a few of the other things that the law is already doing for the people of Minnesota. And this stuff is all in the law and happening. And I'm just telling what's going on right now. Now, first of all, starting tomorrow, August 1st, 900,000 women in Minnesota and 47 million women around the country will have free access to preventive health services, including gestational diabetes screenings, preventive health visits with their doctors, and FDA-approved contraceptives. Because of the health care law, women, not insurance companies, can now make decisions about their health care and can access the services that will keep them healthy. The health care law is also helping families in Minnesota and across the country by prohibiting insurers from denying health coverage for children who have pre-existing conditions. I've met children who are alive today because of this provision. And as a parent, I know how grateful their parents are. Parents around the country can now sleep a little easier knowing that if their child gets sick, they'll still be able to get the health care coverage they need. We should be celebrating that. You know, this isn't about putting the government between you and your doctor, as I hear sometimes. This is about getting the insurance company out of the way and making sure that children can get coverage and adults. We have seen the elimination of lifetime limits on care. Your insurance company can no longer put an arbitrary cap on your care. I've seen a gentleman whose life was saved because of this. Because before this law came into being, they could drop you. And they did. And that's over. That's done. People don't have to worry about hitting an arbitrary limit and then being thrown off their insurance because they have. We should be celebrating that. That's something that should be creating a lot of relief for people, and that's why we're going to be having far, 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 far fewer bankruptcies. Parents will also be relieved to know that young adults can now have been able to stay on their parents' health care plan until the age of 26 because of this provision. 35,000 young adults in Minnesota are now insured on their parents' policy. Seniors. I was at a senior center in Woodbury the other day. And the seniors are very happy with the changes that the health care law has made. When I visit senior centers in Minnesota, I hear relief from seniors who now can pay for their medications thanks to the provision in the health care law, which is closing the donut hole. The provision has already allowed 57,000 seniors in Minnesota to receive a 50% discount on their covered brand name prescription drugs when they hit the so-called donut hole at an average of $590 savings per person. And I can see the presiding officer nodding. I know you go to senior centers in New Hampshire and know that when seniors hear that people want to repeal this, they're miffed. I've actually been at a senior center where they went, what can we do? And wanted to get up and go out and start being activists for the health care law when they heard that some of my friends want to repeal this. because some of them are just, they're making it just on Social Security. And now the donut hole is closing, and they like that. And it means that they can take their medication. And it means they don't have to take it every other day, or they don't have to cut it in half. And my friends on the other side want to repeal it. Seniors are also getting free preventive health services under the health care law, like mammograms, colonoscopies, as well as free annual wellness visits with their doctor, and boy, do they like that. Listen, I could go on and on, I won't. But the point is that because of the law, more people are getting care, the quality of our care is better, and we're lowering costs, and I am proud of that. As we here in the Senate head home to spend August in our states, I urge my colleagues to listen, as I do, when constituents tell us about the rebates they received. I was on a plane 2 weekends ago. A woman showed me her check. The woman I was sitting next to showed me her rebate check. So I urge my colleagues to listen to constituents talk about the rebates we receive, the kids who are able to stay on their parents' insurance, the health screenings that save the lives of grandparents. I hope they'll listen to the stories of kids with pre-existing conditions who are finally able to get coverage, and seniors who are able to afford both their prescriptions and their dinner. I urge my colleagues to acknowledge these benefits and to support the continued implementation of the Affordable Care Act. Thank you, Madam President, and I yield the floor.